Well, good afternoon. I'd like to say thank you on behalf of the Department of Veterans Affairs and Brian and I for being up here. In Agilex. It's an honor to be up here. It's interesting, the diversity of innovations that are up here, and we're going to show you just a different perspective on an innovative program that we came together on. So my name is Wyatt Smith. I'm a physician by trade. I helped develop the program. Brian actually does the hard work of implementing the program. We're about 7 months into deployment of the program, so this is not something that's vaporware or going to go out. It's actually being used by patients. Our program is about people in need and also innovative technology to help them change their world. See, I guess. So a little bit of background. You've probably read a lot, over the last couple of years, the Obamacare, that we really need to change our health care and the way we deliver health care. That circle there is actually taken from the Army Surgeon General's presentation about a year ago or so, but it brings out a good point about our health care and the way it's delivered. If you think about it, there's over 500,000 minutes in a year. Of that 500,000 minutes, let's say you have something like hypertension, high blood pressure, a simple problem. When you go in to get care for that, you go in maybe 3 times a year, and the usual face time that you have with a clinician is about 15 minutes each time. That's about 45 minutes per year that a provider has to help lay out a plan for you, to make you, to help you get better, to make changes in blood, in medications and those kind of things. In addition to that, think of the time that you go, let's say you're a half hour away from wherever you go to get your care. Well, that's a half-hour drive there, half-hour drive back, and in addition then, you've got the parking and everything else. So what our program is trying to do is to reduce that time. Our program is really focused on getting patients their healthcare data wherever they go on a mobile platform and provide communications with their healthcare staff. The patients that we're talking about are severely disabled veterans. Brian's going to talk a bit about that on the next couple slides. This integrates into their daily lives, and we think that it's going to reduce the amount of visits that these folks have to make appropriately and improve their quality of care. We asked veterans what do they want? What do they want in their health care? Well, they wanted us to use their time wisely. These things, I'll let you take a look at these. These things are things that you guys would all relate to if you get health care also. So here's the quad chart, and I'm just going to make an analogy here for the risk piece of it. Just think about doing banking. If you had to go into your bank every time to get your banking records or your MasterCard record to figure out what to do with your banking stuff and get permission from them. It's crazy. That's our healthcare system. So what we're trying to do is change that and provide online banking and online services for healthcare. I'm going to let Brian take it over here. So.
Thank you, Dr. Smith. So what we wanted to talk about is all the things that Dr. Smith talked about and how we executed that from the Department of Veterans Affairs. So we partnered with Agilex, was our technology partner, and we also worked with the Family Caregiver program within the Department of Veterans Affairs to build a suite of 11 mobile apps. Our target audience of this was caregivers who were caregivers of post-9/11 seriously injured veterans. So these caregivers have the responsibility to take care of these veterans. So you can see the list of mobile apps on the right over there. I'll highlight a couple of them. Summary of Care is one that actually allows actually allows the caregiver or the veteran to look at their IEHR records, so they can actually look at their appointments, their schedules, their medications. All that information is provided to them through the device. So this really helps whether if they're in a VA clinic somewhere else, or maybe they're going to see their primary provider. So you can take a look at those. There's RX Refill, which lets the veteran or the caregiver help the veteran refill their prescriptions. So we actually took 1,000 iPads. And you really, that's it?
She's mean.
Yeah, it's just too tough.
Sarah's tough up here with landscaping, that's all I can say.
Rick, absolutely. I mean, huge accomplishment in terms of really fundamentally transforming the patient-caregiver relationship, which is a tremendous opportunity, but also a huge undertaking. And obviously, we were able to accomplish some tremendously significant things in a relatively short amount of time. Listening to what the patient is looking for, integrating with complex things like the back-end electronic health record system, and displaying that on a mobile device. That's just an amazing achievement in a short amount of time.
The mission's unquestionable, obviously, with electronic health record. Innovation is, creatively applying technology, people, and process, and this is one of those where the technology is impressive, but the people and process as well behind this is part of this story, and it's impressive, certainly.
Yeah, I would just add the continuum of care for those coming from the front lines is extraordinary, the need out there, and with 1 and 2 of our soldiers, sailors, airmen, and Marines coming from rural areas that may not have a 10 or 15-minute commute to go get that care, this is very important. So thank you to the team for that.